This is Dr. Raghuram, Orthopaedic Surgeon, Pace Hospital, Sci-Tech City. We are going to discuss about the causes, treatment of the neck pain. We come across a lot of cases of neck pain in our OPD daily. So hopefully this video will be helpful to you in treating of your neck pain. So the common causes of neck pain include overuse pain or the mechanical neck pain. The other common reasons include the pain which is due to the cervical spondylosis. Very rare causes of the neck pain include cervical rib, that is a rib which is coming out of your vertebra. So normally if you see the cervical vertebra or the bones in the vertebral region are 7 bones. In between these bones there are few gel-like substance which is called a disc. So the people who sits for longer times, who watches the screen for more than 8 hours or 10 hours per day, for example a person who does a desk job, an IT worker, a driver who looks the road for more than 8 hours or 6 hours continuously will have these type of problems. So in nutshell, the common reasons would be a cervical spondylosis, very common mechanical neck pain. So more than sleep disorders, the neck pain is more related to the position of your sleep. So few people sleep on sideways with neck in abnormal positions. So if these sleep positions which are abnormal are being repeatedly done every day, every night, then you may have pain over a period of time which is related to your muscle spasm. Over a period of time this can even go for a cervical spondylosis, but this usually takes around 10 to 15 years of age for this to happen. So if you are actually sleeping in an abnormal position for longer days or longer years, it is better to change your sleep position to prevent the neck pain. It is definitely not normal for the neck pain to radiate down your arm. See, actually radiation or radiculopathy for the neck pain to your arm is exactly the pain begins here in the initial stages where you have only neck pain. For a period of time your neck pain actually comes down through your arm. Sometimes even it goes to your fingers and hand also. Few patients may have paresthesia. Paresthesia is exactly the numbness or abnormal sensation like heat sensation or a burning sensation in your hand, arm or etc. So if your neck pain is radiating to your arm, it is definitely abnormal. It indicates that your nerve which is there here, the spinal cord nerves are being affected. Very few times if your neck pain is radiating to your arm, especially left side, then you should be worried about your cardiac or heart status also. Very few times it could be your heart problem which is radiating to your left arm. So if the arm is involved, it is definitely not normal. You are supposed to take an MRI to rule out your spinal cord or the spinal nerves. If it is something related to your heart, if it is associated with your abnormal breathing sensation, or if you are having excessive sweating along with your radiation to the arm, then you should be worried about taking an ECG or finding a cardiologist to find the reason for your pain in the arm. See, usually the neck pain could be diagnosed with our clinical examination. You have to go to an orthopedic surgeon or a spine doctor to go there. He will examine your neck, he will examine your arms if you are having a radiating pain to your arm. So if you want to get a diagnosis properly, then we have to get an X-ray done for your neck so that we can see all the vertebral bodies. And if you are having some numbness or the pain continuously coming to your limbs, the arm or forearm, then you have to undergo an MRI cervical spine. See, how is X-ray and MRI different? In X-ray we can see only bones. So if I am as an orthopedic surgeon expecting a problem in bones, then I have to definitely go for an X-ray. So if I am suspecting something other than the bones, if there is some problem in your disc which is present in between the two vertebral bodies or the bones, then I have to go for an MRI to rule out the problem in the nerves and disc between the two bones, which is exactly the cervical spondylosis and nerve involvement in the spinal cord. So the probable test would be an X-ray. Very few times it's an MRI. Very few times the pain may have progressed. Patient may come with weakness of their limbs. Patient may have weakness in his hands, arm or his legs sometimes. In that case, we can even go for a nerve conduction study to see whether the nerves are functioning properly or not. yes, your neck pain can be a sign of your spinal cord problem, because if you see the anatomy of your neck, there are lot of muscles here which keep your head straight and your neck function. Other than the muscles, there are bones here, the skeleton, where there are the vertebral bodies. Other than that, there are spinal cord, there are few arteries and vessels here. So if there is any problem in the nerves, that is exactly the spinal cord, definitely you will have neck pain. But that doesn't mean that all the times if you have neck pain, it doesn't mean it is something related to your spinal cord. Most of the times it could be due to your muscles which are very tight, because of the prolonged watching to the screen, working for more than 8 hours or 9 hours, or sleeping in abnormal positions. So most of the times it is related to your spinal cord, but it doesn't mean it is always related to spinal cord. So if you are having doubt whether it is related to spinal cord or not, we have to undergo an MRI, cervical spine, so that we can see the spinal cord in that MRI scan and rule out whether the really spinal cord is there or not. See, most of the neck pain which you come across in a daily life is something related to your muscle spasm, abnormal posture, or abnormal sleeping position. Usually these pains which are related to your muscles will be reduced with your normal analgesics, that is painkillers or muscle relaxants, for more than 1 week, or after taking proper rest for 1 week. If this pain is not getting relieved even after 1 week, if you are having the pain persisting for more than 1 week even after taking tablets, then we have to go for an orthopedic surgeon to rule out other problems which are very serious. It could be your spinal cord, or it could be your vessels, or it could be your bones here. In that case, definitely you have to meet an orthopedic surgeon or a spine doctor to rule out the problems here. The neck pain which is there for long, which is a chronic neck pain. See, we call chronic neck pain as the pain which is there for more than 3 months or even more than 6 months. So if this pain, when it gets affected your spinal cord, you may have a long-term disability problems like weakness of your limbs. You may have numbness of your fingers. You may not feel the heat and cold with your fingers. You may not be able to move your fingers because of the weakness. So definitely it is going to create a long-term disability. But for this long-term disability to happen, it will take a lot of time. So it doesn't mean you should relax. So whenever you have the red flag signs like numbness, pain which is coming from your neck to the arm or the fingers, it is a red flag sign. You are supposed to meet an orthopedic surgeon or a spine doctor. Better to get your MRI cervical spine done so that we can see the nerves are affected or not. So definitely it is going to create a long-term disability. Whatever problems which we tell as cervical spondylosis, that is exactly the disc between the two bones, it is not going to come back. If it happens, it happens. Very few treatments are there to bring back your neck to normal. So it is definitely a long-term disability over a period of time. See, the treatment options for neck pain vary according to your severity of the pain. So if I come across a patient who is having neck pain for maybe for 2 days or 3 days, maybe because of overuse of the neck, that is watching a movie or watching a long series for more than 8 hours, or driving for more than 8 hours, definitely I will suggest him a short-term treatment, that is muscle relaxants, rest, hot pack application here. So that treatment will be very easy. Very few people, or most of the people who are neglecting this neck pain for years or months together, they may have cervical spondylosis. So this cervical spondylosis should be treated in a very serious and disciplined manner. So these people have to definitely have some muscle relaxants for initial settling of the pain, but later these people should correct their posture while sitting. They have to get up from their position when the pain is very severe, maybe every 1 hour. And these people who are not having a relief with their painkillers or analgesics or rest, they should definitely undergo physiotherapy session. This physiotherapy session is exactly application of heat by interferential therapy, or exactly the ultrasound therapy for your neck, so that the muscles get relaxed and the inflammation gets settled over a period of time. Very few patients who have radiculopathy, who have numbness, who have definitely a spinal cord or spinal nerve involvement after getting MRI cervical spine done, they may need surgery. Very few patients may be doing good with an steroid injection here, epidural steroid injection. But yeah, if the epidural steroid injection is not working, in that case definitely they have to go for a surgical removal or the correction of the disc problem here. See, the neck pain prevention is very easy. So let's consider a neck pain patient who is a IT employee who is working for more than 10 hours or 12 hours watching the screen. So always the screen which you are looking at should be at your level of your eyes. If you are working for 10 hours together, you have to take a break from the screen from every 40 to 50 minutes. You have to get up, you have to come away from the screen, do the routine cervical or neck stretching exercises for 1 minute or so, then come back to your seat and continue the work. So if you are having pain, then you have to lie down, relax your neck for at least 1 hour or 2 hours. So if you are having pain and if you are still working, this pain is not going to reduce. So whenever you have pain, you have to definitely relax. There are few patients who have pain for more than 6 months or 1 year. They definitely have to see the orthopedic surgeon and do the proper treatment. But the prevention for those patients who are having pain for more than 6 months or 1 year or so, they definitely have to wear a collar so that your neck stays in anatomical position or the best position for your work. So definitely you have to go take a break for every 1 hour so that your neck will stay good. If you are having pain, if you are having stiffness here, if you are working for more than 8 hours and 10 hours, then, and if you are not taking a break for more than 1 hour, then it is definitely a red flag sign. You are going to suffer in your future. More than that, you are supposed to strengthen your neck muscles. So if you are having pain already, then you are supposed to do the neck strengthening exercises. Keep yourself fit. That will also help you. This is how you prevent the neck pain when you are if you are an IT worker or if you are a person who is doing a desk job. This is a basic information which is about the neck pain. But if you have still queries about the neck pain, or if you are already suffering from neck pain and if you are not relieved with the treatments which were given previously, you can definitely come and meet us in Pace Hospital. Hopefully this video will be helpful to you in prevention of the neck pain and treatment modalities.